mindful that some businesses are going to choose to continue to have a masking requirement, and we are supportive of that. We are very supportive of that, whether it's schools, businesses, other organizations. And that's because, as the CDC has made very, very clear in its public announcements, the masking message applies to those individuals who have been fully vaccinated. I cannot think of a more powerful argument as to why an individual should become vaccinated. What we have seen, and Dr. Weston has talked about this, the health commissioner, the health officers have talked about this. Vaccinations have been incredibly effective. They have helped us lower the disease burden. They have reduced mortality and morbidity. They have reduced hospitalizations. In short, they have worked. They have worked. And as a result, the CDC, acting on science, has issued the edict that it issued last Thursday. We in the city of Milwaukee are, as we have throughout this entire pandemic, following the science in the public health. And just as we have at every juncture along the way, we are continuing to follow the guidance of the CDC and the public health experts. So if you are not vaccinated, you are much more vulnerable to COVID-19 infections. You are also more likely to spread the disease to others. So I have two requests for unvaccinated people. Continue to wear a mask in public settings, and please get vaccinated. We are continuing a very aggressive outreach for vaccinations to get them in the community, and I'll touch on that in a few moments. But vaccination continues to be our greatest tool in defeating COVID. And the proof of this is actually in the pudding. This week, the city of Milwaukee reached the 40% mark for adult vaccination. There's still a racial disparity that I'm concerned about, and we are continuing our very proactive and aggressive efforts to make sure that we do not have a racial disparity in vaccinations. But the Milwaukee Health Department has really done an excellent job of connecting with community partners to get vaccine to the people who want it. One of our great partners, the Milwaukee Brewers, will be hosting 2 walk-in vaccination clinics next week on Wednesday, May 26th from 4:10 to 6:30 p.m. and Thursday, May 27th from 9 a.m. to noon. Vaccinations will take place in the atrium of Hellfire Field. And here's some more great news for sports fan. Anyone who is vaccinated at the Brewers vaccination clinics next week will receive 2 free tickets to that day's game. So again, a powerful incentive. And I know there are other organizations that are offering incentives as well. But if you get vaccinated next week, before the Brewers game, you can go see the game for free. I've also announced earlier this week that public vaccination clinics have begun at 3 of our Milwaukee Public Library locations: Zablocki on the south side, Washington Park, and Mitchell Park. As well, there are 5 MPS locations: Morris Middle School, Rogers Street Academy, Roosevelt Middle School, North Division, and South Division high schools. Friday, again tomorrow, the Mexican Council continues to offer its vaccinations from 3 to 5 p.m. And this Saturday, May 22nd, 2 churches will be offering vaccinations to the community. New Direction Church, led by Pastor Eugene Cohen, located at 2127 West Garfield Avenue from 10 a.m. to noon, and Canaan Missionary Baptist Church, led by Pastor Fred Jones, located 2964 North 11th Street from 10 a.m. to noon. Finally, vaccinations continue to be available at the Northwest and Southside Health Centers, as well as Wisconsin Center, which will be offering its last full day of vaccinations next week, Friday, on May 28th. I don't want to steal the thunder from Dr. Weston or Darren, but since it's Thursday, I do want to give you a brief update on our gating metrics, which I'm happy to report continue to show a decrease in disease transmission. While we remain in the substantial transmission category for the rate of COVID-19 cases per 100,000 population, our number has dropped from 80.3 last week to 56.3 this week. That is a sizable drop. That's a very significant drop, and I'm very pleased to see that. We are also remain in the moderate transmission category for percent positives, but we're down again, and this is great news, from 4% last week, excuse me, to 3.3% this week. As all this good news comes in, again, I caution people, if you're not vaccinated, wear the masks and get the vaccination. But that leads me to a brief conversation about city government and government buildings. The changing public health guidance has prompted lots of businesses and organizations to review the precautions they have in place. And that's true here at City Hall. We have begun reviewing the options for reopening. While thousands, in fact, the vast majority of city employees have been on the job in their normal positions. In other words, police, firefighters, sanitation workers, snowplow operators, some librarians and inspectors, various government buildings like City Hall, although still operating and still doing business, have largely been closed to the public. I've been working with our employee relations department and our health department to determine how we will reopen those buildings to the public. Again, work is being done, but how do we interface directly with the public? So I expect in the not too distant future, we will have more specifics to share about reopening. Finally, I want to take a couple minutes to share that we've launched the 2021 Milwaukee Active Streets program. And for those of you who aren't familiar with this program, it really has a couple advantages. It shows our commitment to all modes of transportation. There's a safety component to it as we understand that there are problems in the community with reckless driving, curbs and curbs and other bump outs are helping us to address that. But this year's program builds off the success of the joint Active Streets program launched by the City of Milwaukee and Milwaukee County Parks in May of 2020. Active Streets was originally created in response to the COVID-19 pandemic and the need to create more safe places to walk, to bike, and to be physically active at a distance from one another. Last year's program was a big success. A survey conducted at the end of the program showed that almost 3/4 of the respondents wanted to see the program continue, with or without the pandemic. And we heard from many residents that they loved feeling safe when using their streets. But we also know that one key element was missing from last year's program, and that was that direct face-to-face interaction and community voice. This year, we adapted the program and requested proposals from community-based organizations to tell us where they wanted active streets and how they wanted to use them. And so I'm pleased to report that we received 10 proposals and selected 4 active streets locations. North 25th Street, which will be run by the Northwest Side CDC, Galena and Cherry Streets, which will be run by United Methodist Children's Services, the streets surrounding Butterfly Park, run by Metcalf Park Community Bridges, and Washington Street, run by 16th Street Community Health Centers. These organizations are each receiving a $5,000 grant from the city to run programs on the street like walking clubs, Zumba classes, and pop-up farmers markets, and to tell us what residents want to see on their streets. Active Streets also supports our Complete Streets effort. Our streets are public places and should be open to all, no matter how you travel, whether it's walking or biking or driving or taking transit. So all active streets will be open to local traffic only, with signs and barricades conveying that information. If you live on one of these active streets, you'll be able to drive on the street and park on the street as needed. So parking for you will not be impacted. Additionally, emergency vehicles and deliveries will still have access to the street as needed. When driving on one of our active streets, we ask you to drive with care, slow down, and yield to people walking, biking, or running. Efforts should be made to find alternate driving routes whenever possible. So again, we're responding to the pandemic. We're responding to the wishes of our residents to have safer streets, more complete streets, and we're proud to be doing that. So with that, I will turn it over to County Executive David Crowley. Mr. County Executive.
Well, thank you so much, Mayor Beard, and good afternoon to everyone. So since this pandemic began, Milwaukee County has made careful, measured, and intentional effort to protect the health and well-being of all of our community members who reside throughout Milwaukee County. And it's really our commitment to data-driven decisions that are in the best interest of the broader community, and that continues. So additionally, with the more than 4,000 county employees, we must also consider how best to protect our dedicated workforce who are critical to delivering essential services to the community every day. And with these considerations in mind, as of June 1st, Milwaukee County's universal face mask administrative order will be amended. So COVID protocols, including masking and social distancing, will continue to be required indoors at all county facilities for both members of the public as well as county employees. This includes masking at private indoor events as well. Members of the public will no longer be required to wear a mask while outdoors at county-owned areas. County employees will be required to wear a mask, though, outdoors at times when they cannot maintain the 6 feet of distance with other people. And when distance can be maintained outdoors, Milwaukee County employees may remove their mask. And while the CDC's new guidance lifted masking requirements for fully vaccinated people in most settings, they still recommend masking for fully vaccinated and unvaccinated people in certain settings. And this includes clinics, detention facilities, hospitals, public transportation, and other settings that are high risk for the spread of COVID-19. And Milwaukee County operates many of these services within these settings called out by the CDC, such as the jail, the House of Correction, the hospital run by the Behavioral Health Division, public buses, our airport, and our court systems. Additionally, the county runs many recreational services that the entire community should be able to enjoy safely when you think about our parks, our zoo, our beer gardens, trails, domes, and many of our pavilions. In outdoor settings, the risk of transmission of COVID-19 is much lower than indoors, which is why we feel confident about removing face mask requirements from the public when outside. But the risk of transmission indoors is significantly higher, and we want to ensure our service remain accessible and safe to all members of the public, while remembering that children under 12 cannot get vaccinated, and that the majority of our population is not yet fully vaccinated. And so it's for these reasons we will be maintaining indoor face mask requirements at county facilities. And while we have made great progress in our fight against COVID-19, we continue to see a high burden of disease throughout Milwaukee County, and our vaccination rates are not yet where they need to be, with only a little over 43% of residents having received at least one dose. We believe the continued diligence and adherence to existing guidelines is critical to our desire to reach herd immunity. And as we have experienced for this past year, we know the information related to COVID-19 is forever changing. And leveraging what we know today, we believe that these changes and the precautions that will remain in place are in the best interest of county residents, our visitors, and our employees. And so we are committed to continue reviewing as well as evaluating county policies based on the best public health information available, including community disease burden, vaccination rates, and CDC and DHS guidance. Ultimately, we will let transmission levels and vaccination rates be our guide. The best path forward for Milwaukee County is for as many members of our community to be vaccinated as soon as possible. Milwaukee County and our municipal and healthcare partners are committed to doing everything that we can to ensure anyone who wants a vaccine can get one in the way that best meets not just their needs, but their ability as well. And so with this in mind, Milwaukee County has launched Healthy Homes. It's Milwaukee County's free at-home COVID-19 vaccination program. And so Healthy Homes will help ensure individuals who have difficulty leaving their home have access to a COVID-19 vaccination. There are many reasons why people may have difficulty leaving their homes, including those who need the help of another person or medical equipment to leave their home, or those whose medical provider believes that their health or illness may worsen if they leave their home. Each county resident has unique needs, and some of those needs present a barrier to obtaining care. So to eliminate those barriers, Healthy Homes meets residents where they are and brings vaccines directly into their homes. It shouldn't be the case that you aren't vaccinated or that your general health care takes a bad turn just because you cannot get access. You can't access the medical system traditionally. We can create healthier communities by making services accessible and by physically meeting residents where they are to connect them to the needed services like a life-saving COVID-19 vaccine. And we know that there is a need for this program in our community. Nationally, about 6% of individuals on Medicare have difficulty leaving their homes. And in Milwaukee County, that may represent up to about 9,500 of our neighbors. Our partners at the city, municipal health departments, and healthcare providers have already made great strides in reaching many of these individuals. But through these efforts, and likely thanks to the efforts of caregivers throughout our community, we believe that roughly 60% of the population have already received their vaccine. We also know that the remaining individuals may be unreached or unknown, and that is where the Healthy Homes program really comes in. The Healthy Homes program is rooted in Milwaukee County's commitment to using data to drive decision-making. Program participants will be prioritized for outreach using the Evaluating Vulnerability and Equity model, also known as the EVE model, which continues to guide equitable COVID-19 vaccine deployment strategies across Milwaukee County. The program builds upon the work already underway by the city of Milwaukee, local health departments, and other local vaccinators to reach this vulnerable population by targeting a hyper-targeted approach. And by taking a hyper-targeted approach. The Healthy Homes program, we really hope to leverage community input in addition to existing data from county and partner programs to proactively make phone calls to individuals who may have difficulty leaving their home and may not have already been reached by previous programs to ensure they have access to vaccination. Additionally, in line with Milwaukee County's No Wrong Door effort, vaccinators will be trained to connect community members with other county services as needed, such as housing, mental health, or transportation services. And through the No Wrong Door model, the county's Department of Health and Human Services has led the way in bridging the gap in health disparities by increasing the points of entry for residents regardless of their age or ability, creating a no wrong door for someone to really enter to receive their needed services that they need. And so we're doing everything that we can to break down barriers to accessing care, including receiving a COVID-19 vaccine. But we need the community to join us and help us connect those in need with available services, including this at-home COVID-19 vaccine option. And so our hope is the result that we will be Our hope is that the result will be even more Milwaukee County community members opting to receive a COVID-19 vaccine. So if you or someone you know is in need of an at-home vaccination or is interested in learning more, please visit healthymke.com/healthyhomes or call 414-257-SHOT. Again, 414-257-7468. We will have trained medical professionals that will make home visits at the appointed time to administer the COVID-19 vaccine to all interested members of that household. Milwaukee County and our municipal and healthcare partners are committed to doing everything that we can to ensure everyone and anyone who wants a COVID-19 vaccine can get one in the best way that meets their needs and abilities. I know I just had a mouthful to share, and I know that there may be a lot of questions, but with that, I'll hand it over to Dr. Weston.
All right, thank you, Mr. County Executive. Good afternoon. First to our numbers, we are currently seeing an average of 64 new cases a day and about one death every 2 days. We continue to have encouraging gradual downward trends across the board in our burden of disease, and our vaccination rates are at about 1,100 first doses per day. So the County Executive discussed our plan for advancing our updates on county masking. And this change to broaden those who can unmask, particularly outdoors, fits with the expert recommendations and the science that's available on the spread of disease, while also taking into account the vaccination rates and disease burden in our community. So we will continue to follow the science and evaluate the trends specific to Milwaukee County as we advance our policies and return to normalcy in a measured but deliberate manner. Now to vaccinations. We've talked about the shift in vaccination strategy from mass vaccination sites where people come to us to more focused efforts, where we work to inform those who have specific concerns about the vaccine and work to break down barriers to those still wanting to get vaccinated. The Milwaukee County's Healthy Homes program is yet another step in a series of many to reach out to those with barriers to vaccination. And those barriers take many forms. It may be the single parent with 2 jobs and 3 kids who's unable to have the hour off of work or the childcare needed to seek out vaccine. Or it may be the healthy 22-year-old who's open to getting the vaccine, but doesn't see the benefit of vaccination that warrants making it a priority for them. Or it certainly may be the 90-year-old who has difficulty leaving their home and can't figure out a way to get to a vaccination site. So we as a community are targeting each of these groups in different, unique ways. But this program in particular is for that 90-year-old and the many, many others in our county who for one reason or another have difficulty leaving their homes. Now, while these individuals are all vulnerable to some degree given their limited mobility, we're working in particular to prioritize those living in the orange census tracts on that EVE model. So those are the communities that combine high vulnerability with low rates of vaccination. But regardless of where you live in the county, if you or a family member or a neighbor is looking to receive a COVID vaccine but having trouble leaving their home, please visit healthymke.com or call 414-257-SHOT, that's 414-257-7468, to set up a time to get vaccinated. Every vaccination counts, both to protect that individual as well as to protect and move our community forward. Thank you and stay safe, and I'll hand it to Health Officer Roush.
Thank you very much, Dr. Weston. It's my pleasure to join this afternoon to talk a little bit about some very exciting data that we have this week. Again, like Mayor Barrett mentioned and Dr. Weston mentioned, the data continues to be very favorable again this week. We continue to see decreases throughout the county, and those decreases are noted not only within the city of Milwaukee, but also the suburban communities. And we see decreases across the whole population as well as in our kids. As also mentioned, vaccination efforts continue countywide, including the newest eligibility group of the 12 to 15-year-olds. And I'm happy to report, and I'll show you the data in just a second, that the percentage of 12 to 15-year-olds who have received their first dose of vaccination is approximately about 6% in just over about a week of eligibility countywide. And overall in Milwaukee County, our numbers are increasing. We have 44% of the population that's received one dose and 37% of the population that's completed their series according to the state website. By comparison, those statewide numbers are 46% and 40%, so we still are a little bit behind, but certainly working to close that gap. So with that, I'm going to go ahead and show you the data for today. So what you see here on the screen is new cases of COVID-19 across the county. And again, for many weeks, we were talking about this increase in March and the early part of April in both the city and in the suburban communities, but very happy to report a decrease within the city of Milwaukee for the last couple of weeks and a continued decrease or plateau in the suburban communities. And similarly, when we look at the kids report, as I've just flipped to the kids data, looking at new cases of disease, the big peak noted in the city of Milwaukee in mid to late April has now decreased for kids, and we continue to see some slight increases in the suburban communities. So some very favorable news by way of disease cases for this week. Now I'll go back to the whole county report. Again, we've seen, as in the past, deaths are very minimal, about a death a day, it looks like, or every other day. And that's very good and reflective of high vaccination rates. We've talked about the reproductive number and that transmission rate before. Happy to report that countywide we are below 1. We're at like 0.79 for the county. We see when we look at the city of Milwaukee, we're also looking at a transmission rate below 1. And again, we see the same in the suburban communities. So we're suppressing that disease by having that transmission rate below 1. All of the race, demographic, age, and ethnicity patterns remain the same from last week, but certainly want to continue to flag growing rates of disease in the African American community, and certainly approaching, as we've talked about in the past week, approaching that number of Hispanic cases overall. Testing remains available throughout the county. Again, we're seeing here on this figure at this point an increase of testing when we had increases in March and April, and now a slight tailing off, but certainly testing is available for those who need it and those who want it throughout the community. We're seeing some very positive trends in percent positivity and seeing that continue to decrease slightly as well. And then lastly, we'll look at where cases of COVID have occurred over the last year countywide, which is this particular figure. And then we look at the next figure, we'll look at where COVID has been more problematic, meaning more cases in the last week. And again, very similar trends. We've got hotspot here in Greenfield and southwestern city of Milwaukee, down here on the south side, and then in the north and northwest side of the city of Milwaukee. So lastly today, in addition to the data, I just want to continue to highlight the importance of parents of adolescents and teenagers to continue to seek vaccine for your kids. Kids 12 through 15 have only been eligible for about a week, a little over a week. 16 and 17-year-olds have been eligible for quite some time here. And again, for parents, if you're looking to vaccinate your children under the age of 18, you need to seek out the Pfizer vaccine. Check with your provider, your local health department, or go to vaccinefinder.org or vaccines.gov to locate providers in your area. That's all I have today. Thanks for your time and attention, and I'll now turn the briefing over to Catherine for the question and answer portion.
Thank you, Director Rausch. Our first question comes from Nick Bohr with WISN 12, and it's for the mayor. He's asking, it seems several members of the Common Council would have liked a public meeting prior to that decision to rescind the order. Any response to that?
I think it's important to have a public conversation about the actions that we have taken, and the council has scheduled a hearing next week, and we'll be happy to have representatives from the health department and my office there to discuss the actions that were taken. I do want to stress that one of the things that I've said repeatedly over the last 14 months is I am very, very proud personally and professionally that I, in the city of Milwaukee, at every juncture throughout the past 14 months, we have followed the science. We have followed the science, and we have followed the lead of public health experts. We have followed the lead of the CDC. That is what we have done this week as well, as we've continued to follow the science. So the decision was a public health decision. It was not a political decision. It was a public health decision based on the statements and the evidence that were presented by the CDC and the President of the United States last Thursday. Now, as I said earlier in my comments, that does not mean we're out of the woods. Clearly, the message that I have given over and over again, and I'll continue to give, is that it is important for unvaccinated individuals to continue to wear masks. Equally important, if not more important, I think right now, all hands on deck are necessary for us to increase the vaccination rate. Because I think that is where we are going to have the most positive penetration. So that's where, in the recent months, I've been putting my energy, and that's where I'm going to continue to put my energy. We have also made it clear that those businesses or organizations that find it in their best interest or in the interest of their clients or their employees to continue a masking policy, that we are supportive of that. We think that that makes sense. So that was the reason that we did what we did. And again, we'll be happy to have individuals that will discuss this publicly with anyone throughout the community.
Allison Durr with the Milwaukee Journal Sentinel does have a follow-up question. She's saying that the Common Council members asked whether the administration considered Milwaukee's lower vaccination rates compared to other municipalities, including for Milwaukee's residents of color, or consulted the pediatricians regarding potential impacts for children who can't be vaccinated. What is your response to this?
Again, we have been following the science. We've been following the leadership of the CDC, and we have individuals in the health department who do have regular conversations with other individuals in the health field. So I feel that we're well grounded on what we have done. I think it poses some of the challenges that we have, and I think this is part of the public dialogue that we do need to have. At what point do you make the change? Again, we have made a very, very, very significant effort, and we continue to make a very significant effort to improve the vaccination rates in the communities, particularly communities of color. And we have done that really from the onset, and we're going to continue to do that. I think it is important for us to take the vaccinations to where people are and make sure that now that we've gone through the first, what I would call third, the people who were chomping at the bit to get the vaccination, now we're still in that middle third, those individuals who, if it's available and if it's accessible and if it's free, which it is, they'll consider getting it. That's where I want to put my efforts. And I think that's where the health department is rightfully putting the major part of its efforts as well.
Thank you, Mayor. You can stay on because the next question is for you from Tony Atkins with TMJ4. He's wondering, can you share some thoughts on the new leadership at the Office of Violence Prevention?
Sure. We announced the new leadership there, Anita Holman, who has been with the Office of Violence Prevention. She's been in the resiliency in community for communities affected by stress and violence, our RECAST program, if you will. It's a federal program and brings a lot of passion. She's got a graduate degree from Marquette University. She brings the right temperament, and I think she is really, really committed to working on issues like mental health issues, trauma issues, gun violence, and we're very, very pleased that she's accepted this position. So we're excited.
Mayor Barrett, the next question is from Madeline Anderson with Fox 6. She's wondering, why did you feel it was okay to move forward with rescinding the mask ordinance and public health order, given that 60% of residents still aren't vaccinated?
Again, I as I have done for the last 14 months, I'm relying on the public health experts and the scientists to guide us. And when the CDC made its decision, and when the President of the United States made the decision, I felt, well, we followed the science, we followed the CDC every single point along the way. We're going to continue to do that now. So I would say philosophical consistency.
Allison Durr with the Milwaukee Journal Sentinel is wondering, Mayor Barrett, the county is holding off for now on lifting its mask requirements, citing local circumstances. Was the city too hasty in lifting the mandate entirely?
Well, again, as you know, the county doesn't have a mandate that goes beyond the county facilities. It deals with the county facilities. So in essence, as an employer and as a landlord, it made that decision. I am fully supportive of the decisions that are made by individuals or institutions that make that decision for their facilities. And so that was a decision that the county made. And again, I'm supportive of that decision. The question is that a decision that applies to every single business, every single institution in Milwaukee? I don't know that it is. And again, if those institutions decide that it is in the best interest, then I'm supportive of that.
Mayor Barrett, Brittany Lewis from CBS 58 wants to know, do you have any concerns about fans gathering for watch parties or at bars for the Bucks playoff game this weekend?
I'm always concerned when we've got groups getting together, but I'm most concerned as to whether people get vaccinations. So what I would ask is those institutions that are going to be hosting these to make sure that the individuals who are there are vaccinated. That's what I would be doing if I ran one of those institutions.
Joyce Garbasiak with WISN 12 is wondering, Dr. Weston, are you pleased with the number of children being vaccinated so far, the 12 to 15-year-olds, or were you anticipating higher numbers in the first week of eligibility?
Yeah, so I think we're still seeing the numbers coming in, and that's been a trend throughout COVID, is that it does take some time for the data to be processed. That's especially the case with vaccinations, as they need to be entered into the state database, and then that data needs to be worked through. So we're seeing a nice uptick in that 12 to 15-year-old age range. I think next week we'll have a better idea of how many 12 to 15-year-olds are getting vaccinated and how that distributes throughout the county as well.
Thank you. Chuck Kornbach with WUWM is wondering, for County Executive Crowley, what is the cost of Healthy Home and how many people will staff it? What was the tipping point that prompted the program?
Great question. So we received a grant from the state of Wisconsin, I believe the Department of Health and Human Health Services, for about $200,000 that is helping us administer this program. I'm not exactly sure how many people is actually staffing off the top of my head, but this has been a pilot program that we have been administering for a while now, but we're just now looking to expand it right now.
And Sharon Bajenda with CBS 58 is wondering, how many home vaccinations have been given out in Milwaukee County and who will be administering these vaccines?
I can start on the second part. Sorry, I'm just looking at the question now. So who is administering the vaccines? We're partnering with a number of different vaccinators. I think there's 8 different organizations right now that we're working with to set them up as vaccinators for in-home vaccinations. Now, that said, the Milwaukee Health Department, other health departments are working on that as well. And about how many we've done, the Office of Emergency Management has done about 50 at-home vaccinations over the last several weeks.
All right. Sari Lask with the Milwaukee Business Journal is wondering, for the mayor, the health department's gating criteria at one time called for an 80% adult vaccination rate being before lifting restrictions. The commissioner later called that a placeholder. Given the order is lifting with a vaccination rate well below that threshold, it would seem the vaccination rate was not a major factor in guiding the decision. Could you elaborate on why that metric appears not to be a big part of the approach?
Yes, I'm happy to do so. I think one of the things that we have seen over the last 14 months is that the landscape has changed repeatedly. And I think what people thought was the right thing to do, perhaps 14 months ago, turned out not to be the right thing. I think people are pleasantly surprised by the effectiveness of the vaccination. And I think there are other impacts that have been occurred as a result of having, in essence, major portions of our society closed down for 14 months. Not the least of which are we've seen increases in violence, we've seen increases in opioid use, we've seen increases in educational challenges. And so I think this is always a balance. It's always going to be a balance. And what the health department and the health commissioner came to me some time ago, and keep in mind that the decision that we made to reopen June 1st replaced the decision we made to open June 15th. So it's merely a 2-week acceleration. But it was based, as I said repeatedly, on what the CDC has said, because we feel that working through the science metric is the best way to go. I don't know, and I think that Dr. Weston has said this in the past, and I don't know that we will ever get 80% of the population vaccinated. And so if we're not going to get 80% of the population vaccinated, does that mean we never reopen? And I don't think anybody is suggesting that we'll never reopen. Would I like to see us get 80% of the population vaccinated? Of course I would. I'd like to have seen that happen 2 months ago. But I think that it's always a balance. It's always going to be a balance as to what the right thing to do is. And one of the challenges that we have, quite honestly, at the local level where decisions are being made is, I don't think any of us, if we knew what the correct answer was, it's not like a math book in high school where the correct answers are written in the back of the book. What we all try to do is we try to use our judgment and we try to look at the totality of the circumstances and what the challenges are. That's why I repeat this, because I think it is so vitally important. Our work isn't done on vaccinations. In fact, we have a lot more work to do. And it's my hope that all community partners, every part of this community, that we band together to improve this vaccination rate for all parts of our community. And I think that if that's where our focus is, which is where I think it should be, I think we'll continue to make the very impressive strides that we've begun seeing already. So that's a long answer to your short question, but yes, we took that into consideration, but we took other factors into consideration as well.
Allison Durr with the Milwaukee Journal Sentinel is wondering, Mayor Barrett, as the City Hall and other buildings where residents come for services to speak to their representatives, et cetera, start to reopen more fully, could you see a mask request or perhaps requirement in place, even if not an ordinance?
Well, again, I think that for we are an employer, so the logic that I've employed so far is that I'm supportive of those efforts of individuals or organizations that want to have a mask ordinance. So I'm not ruling that out for city facilities. Again, we just this morning had a cabinet meeting. We had a meeting with the representatives from our Department of Employee Relations and our health department, as well as the library. The library was an active participant in this as to what the wishes are of the employees, what the wishes are of individuals are coming. The point that we wanted to make for city government that is that the outward facing portions of city government, we're starting the conversation as having those open to the public again. Again, the work is being done, but we want to make sure that we're having a orderly transition back to normal for at least the outward facing employees.
Those appear to be all of the questions for today's briefing. However, we do have a Spanish language portion of our media briefing. So I will just give a quick pause, let the media outlets who are dropping off, you guys can drop off, and then we'll transition over to our Spanish language interpreters. Miguel and Carlos, are you with us?
Yes, here we are.
Excellent. Let me just begin recording here. All right, you guys can begin with the county executive's talking points, and for media who are joining, please feel free to put your question in the chat and we'll follow the same format as we do for the other briefing. Go ahead, Miguel and Carlos. And if you're comfortable, feel free to turn your camera on as well.
I'm sorry, can you clarify what it is you are asking us to do? This is the first time we've done this, and I'm not sure.
Oh, sure. Let me just pause here. So I believe you have County Executive Crowley's talking points. So if you want, you can just begin recording those. This portion of the briefing is slightly different than the beginning portion, so you can read those questions. I will record it, and then I send a link out to any media outlets that weren't able to attend. So you can just go ahead and read the talking points, the translated talking points for County Executive Crowley.
Oh, I don't believe we have them translated, but we just decide to translate them.
If it's helpful, then if they're not fully translated, then maybe we can end the briefing and we can circle back and record them, and I can send them out after this briefing.